Ever heard that undigested milk increases blood acidity, leading to calcium loss from bones? Well, it's time to debunk this myth. This idea, although intriguing, is a misconception. Yes, some people struggle to digest lactose, the sugar in milk, due to a lack of the enzyme lactase in their bodies. This condition, known as lactose intolerance, can indeed cause some uncomfortable symptoms like bloating, gas, and diarrhea. Yet contrary to popular belief, even undigested milk does not directly increase the acidity of our blood or cause calcium to leach from our bones. Our bodies have a sophisticated system in place to keep our blood pH levels stable, regardless of what we eat or drink. This system primarily involves our kidneys and lungs, not the digestion of any specific food, including milk. So if milk doesn't affect our blood acidity or calcium loss from bones, what happens when we digest it? Let's dive deeper into the process of digesting milk and the effects of lactose intolerance. Milk contains a sugar known as lactose. To digest lactose properly, our bodies require an enzyme called lactase. Some people, however, don't produce enough lactase, and this is what we refer to as lactose intolerance. Symptoms can include bloating, gas, and diarrhea, which are certainly uncomfortable, but don't directly affect blood acidity. Now you might be wondering about the role of milk, or any specific food, in regulating blood pH. Well, our bodies are rather impressive. They have a complex system in place to maintain blood pH within a narrow range, and this isn't majorly influenced by our diet. The heavy lifting is done by our kidneys and lungs, which play a primary role in regulating blood pH. But then, what about the relationship between milk and bone health? Milk is often touted as a great source of calcium, which is crucial for bone health. But the story doesn't end there. Yes, milk provides a rich dose of calcium, a mineral that plays an essential part in building strong bones. But calcium isn't the only player in the game of bone health. Vitamin D, weight-bearing exercise, and even your genetics play significant roles too. Now let's touch on lactose intolerance. Some research suggests a link between lactose intolerance and lower bone density. But the reasons for this aren't fully understood, and it's important to note that this potential link might not have anything to do with increased blood acidity. As we've seen, lactose intolerance and milk consumption can have various impacts on our health. But remember, if you have any concerns about lactose intolerance or bone health, it's always best to consult a healthcare professional.